We don't have quorum yet, but we will get started. Welcome to the Health and Human Service Reform Committee. Representative Barr, if you can make your way down. When Representative Barr presents, we will move at that point that House File 1188, the bill that he has up, be referred to the Health and Human Service Finance Committee. Representative Barr, unofficially, we have the bill in front of us. Actually, now we do have quorum, so I'll call the meeting officially to order. Representative Kresha moves the minutes from Wednesday, March 8th, 2017. Are there any additions, corrections, or changes to be made to the minutes? Seeing none, all those in favor of the minutes signify by saying aye. Aye. Opposed, same sign. The minutes from March 8th are adopted. Representative Kresha then moves that the minutes from Thursday, March 9th, 2017 be adopted. Are there any additions, corrections, or changes to be made to the Thursday, March 9th minutes? Seeing none, all those in favor of adopting the minutes from Thursday, March 9th, 2017 signify by saying aye. Aye. Opposed, same sign. The minutes are adopted for Thursday, March 9th. And now I will move officially that House File 1188 be re-referred to the Committee on Health and Human Service Finance. Representative Barr, we have the bill in front of us. I understand you have an amendment.
Yes, Mr. Chairman, the A-17.
All right, I will move the A-17 amendment, and this is to get the bill into the form in which you'd like to present it. Are there any questions on the A-17 amendment? Seeing none, all those in favor signify by saying aye. Aye. Opposed, same sign. The A-17 amendment is adopted. Representative Barr, to your bill as amended.
Thank you, Mr. Chairman, and this is my first time in front of the committee, so I have brought the obligatory treats, if the page would help me out here with that, and to the bill directly. Yeah, this is just it's a revenue neutral, but it cleans up the funding formula for how counties are reimbursed for their homeless shelters. And with that, I'd like to turn it over to my testifier.
All right, welcome to the committee. If you could please state your name for the record and present your testimony.
My name is George Burrell. I'm with Anoka County Social Service and Behavioral Health. Thank you, Representative Barr, Mr. Chair, committee members. To give a little background on this, group residential housing is authorized as on an individual basis by applying for cash assistance with county economic assistance departments. It is common for homeless shelters to rely on group residential housing for a significant portion of their funding to pay for the room and board costs of the adults staying at the shelters. The only adult homeless shelter in Anoka County utilizes group residential housing to fund a portion of its expenditures for a 66-bed facility. During state fiscal year 16, Anoka County's Economic Assistance Department processed a total of 717 paid transactions for group residential housing at our homeless shelter, for a total of $371,000. Anoka County employs 1.5 FTE financial workers just to process the group residential housing applications for our one adult homeless shelter. If approved, this bill will allow the Department of Human Services to make a cost-neutral transfer of group residential emergency shelter bed funding to county human service agencies with existing shelters. The funding will be allocated annually and adjusted according to the percentage change in the group residential housing room and board rate. Counties can opt in or choose to continue using individual client eligibility for group residential housing payments at their shelter. For those counties that opt in, a biennial plan will need to be submitted by the county to the DHS commissioner for approval before any transfer of funds occur. The DHS commissioner or a county may return beds to the group residential housing fund with 180 days notice, including financial reconciliation. The outcomes we believe this will achieve are an increase in financial stability for the emergency shelters who rely on this funding, and the administrative simplification will decrease costs associated with the management of GRH for emergency shelters and counties. Thank you for this opportunity.
All right, thank you, Mr. Burrell. Representative Barr, do you have any other testifiers?
No, Mr. Chair.
All right, are there any questions for Mr. Burrell? Seeing none, is there anyone else who wishes to testify on House File 1188? Seeing none, final questions from members on House File 1188. Representative Liebling.
Thank you, Mr. Chair, and good morning.
Good morning.
So is there anybody that you're aware of that is opposed to this?
Mr. Burrell.
No, I am not.
Representative Liebling.
That's all, thank you.
All right. Any final word, Representative Barr?
No, Mr. Chair.
All right. With that, I'll renew my motion that House File 1188, as amended, be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 1188, as amended, is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Barr.
Thank you.
Next up this morning, we have Representative Pearson, and I will move that House File 1384 be re-referred to the Committee on Health and Human Service Finance. We have the bill in front of us, Representative Pearson. When you are ready, to your bill.
Thank you, Mr. Chair. Thank you, members of the committee. House File 1134 really addresses basically a disparity in some of the funding of what we do for specific programs dealing with addictions in the state of Minnesota. Particularly in Olmsted County, we have an adult and teen challenge facility that has a different reimbursement rate than what other similar facilities have throughout the state of Minnesota. I think the key elements that I want to point out before I turn it over to the testifier, I'll try to learn from Cal and keep my comments brief, is that Minnesota Adult and Teen Challenge has proven their effectiveness throughout the state, and that we just need to make sure that those resources are offered to people in outstate Minnesota, in greater Minnesota, and that they're also increase the access for women throughout the state of Minnesota. And so I have Tim Walsh here, and two Adult and Teen Challenge clients are here to tell you a little bit more about what this supplemental rate could mean for them for securing more long-term funding to successfully get people through addiction programs.
All right, Mr. Walsh, welcome to the committee. If you could please state your name for the record and present your testimony.
Yes, Mr. Chair, my name is Tim Walsh, Vice President at Minnesota Adult and Teen Challenge. Thank you, members of the committee. The 104 beds that we are going to have as of October in Rochester are going to serve both men and women. It's long-term group residential housing with supports and treatment. As we look at all the research of what works to help people to break the bonds of addiction and also to transform their lives, we find that longer is better. And we find that just housing all by itself is not going to do it. That our clients, because of their multiple disabilities and life issues, they require that long-term, and they need numerous supports and treatments. We have done studies through the Weiler Foundation, a number of studies on our services, and we find that our effectiveness rate is anywhere from 74 to 76% in a 6-month follow-up of our graduates. We also find that in our research that our programs help to improve the transition to self-sufficiency and independence, which is the goals of the GRH program. As you look at the whole menu of services that are provided through group residential housing services across the state, we provide almost all of those services. So not just the 4 minimum that are required for an exception rate, but almost all of the supports and treatment services that are provided at GRH facilities across the state. To put in perspective our request, 1 month at the highest rate chemical dependency treatment program in the state pays for a whole year at Minnesota Adult and Teen Challenge. The GRH funds pay for less than half of our costs. The rest come through donors and other funds. And we are less costly than a prison bed for 1 year in Minnesota State prisons. So that's why we're hoping for your support today on House File 1384. And our residents, I think, tell the story much better than I do.
All right, welcome to the committee. If you could please state your name for the record and present your testimony.
My name's Lindsay French. I just want to say good morning, everybody. I'm from Rochester, Minnesota. I'm 30 years old, and I've been struggling with addiction for about 12 years. I had a scholarship for hockey, and I decided to drink that away, and that was the beginning, downward spiral for me. I started getting into some harder drugs and became very addicted and started committing crimes, and I ended up in prison 4 times. And then that was the journey of, for the last 6 years, I've been in and out of treatment centers, in and out of jails. It took a toll on me 2 years ago. I got addicted to heroin, and that kind of took my soul from me. I have a 5-year-old daughter who I want to be in her life, so I decided I have long-term problems, so I needed a long-term treatment center, and I've been to 12 treatments and halfway houses and outpatients, and nothing really clicked because I needed structure for a long period of time. So I entered Teen Challenge last year, and I graduate in June, and it's like been a total like eye opener for me. I've like learned to find my purpose in life. I've had over 10 and a half months of sobriety, and it's been like 8 years since I've been that sober. And like I can think clearly, I have motivation and drive, and I just, like I feel a change. I don't have to be like fear-driven anymore like my past. So I just want to say thank you for listening to me, and have a good day.
Thank you, Ms. French, for your testimony this morning and for sharing your story with us and the effectiveness of the programs that you're experiencing there and being able to do it with such confidence. Really appreciate that. Welcome to the committee. If you could please state your name for the record and present your testimony.
Thank you. My name is Victoria Liebel. I am also from Rochester. I have been, like Lindsay, to over 12 treatments. I suffer from, I've been addicted to methamphetamine and heroin for over 15 years. I think that if there was a program like this down in Rochester, if there was sooner, I think my life would have changed a lot sooner. I entered the program last April up in Minneapolis here, and it's completely changed my life. The 2 years prior to coming to Teen Challenge, I was using heroin every day, and down in Rochester, and there was a couple of sober houses down there that were funded by GRH, but no one there was sober, and I actually lost my boyfriend to a heroin overdose almost a year ago. And that was when I realized that, like, I can't do this anymore, and I needed something long-term because the 30-day treatments that I had been to prior didn't even begin to scratch the surface in changing my life and the root of my problems. So, thank you.
All right. Thank you, Ms. Liebel, for being with us this morning and sharing your story. Are there any questions for these testifiers? Seeing none, is there anyone who wishes to testify from the audience on House File 1384? Seeing none, final questions for the bill author. Final word, Representative Pearson.
Thank you for your consideration, Mr. Chair.
With that, I'll renew my motion that House File 1384 be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye, opposed, same sign. The motion prevails, and House File 1384 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Pearson. Is Representative Metza here? Yes, thank you. Representative Metza, I will move that House File 885 be re-referred to the Committee on Health and Human Service Finance. We have the bill in front of us. Representative Metza, when you are ready, please present your bill.
And thank you, Mr. Chair. We did bring a couple things for the committee members here to review. If I could get the committee administrative staff to get these out. I didn't mean you, Representative Dean. You sure?
One of each.
Thank you. Yeah. Well, thank you, Mr. Chair. That just shows Rangers stick together.
Dang right.
Well, I'm actually very honored to be here today presenting this bill. We've been meeting with a program that Shelley here, who will testify shortly, put together on her own with her own finances. And it's a place called Catherine's House in Eveleth. And we've seen over the course of a few years here, many of our other programs dissipate. And this was someone who took the initiative, took a problem, and built a solution on her own. And so I think her words and our testifier, Cindy, will speak far better than mine, but we're basically in the bill asking the county to fund this program because it doesn't meet the qualifications. But I think after you hear the services, you'll see why we're asking for this small change in the actual language.
All right, welcome to the committee, Ms. Holmes. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chairman. My name is Shelley Holmes, and I'm from Evelyn, Minnesota. I started a board and lodge with supportive services for women only in Evelyn. I named it after my grandma, Catherine Petrini, so it's called Catherine's House. It's the first time in the history of the Iron Range that there's ever been women-only housing, not to mention with supportive services. We passed around a flyer that kind of just gave a little bit more of a breakdown as to how I feel that we're different from other typical board and lodges, especially in St. Louis County and maybe even statewide. But my company is called Lotus Corporation, and I created a program called the Lotus Strategy, and it is for a long-term wraparound services where we include the key person or people in the resident's life, and we meet once a month with them on an, so it's on an ongoing basis. And where we're different is in the typical board and lodge supported by GRH, you have a requirement of 4 hours a week of nursing. We have 2 full-time nurses, an RN and an LPN, that each do 40 hours. We find that there's a lot of health concerns and issues, Hep C, female issues, chronic pain, et cetera. And so we try to address all of that. That's very costly. We have a 32-year psychologist on staff. We try to work on, every day we have groups on life skills and parenting skills. I have a building right next door to Catherine's house that I renovated that has a furnished apartment upstairs. And that was designed for the women to be able to have supervised visits, to cook and play games and have activities and stay overnight and reunite with their children and families, to have a second chance to maybe put the family back together, to get the children out of foster care, and if it's the right decision, and throughout the process of the life skills and the parenting skills and the psychology and everything, we could determine that that is the right thing for the children. I'm a firm believer in that. But we struggle with transportation on the Iron Range. And so I have purchased vans and I have drivers, and we're off and running to the horse farm for equine therapy and gardening and as many activities as we can possibly do, taking them out for job interviews to encourage for employment, to move on. I don't feel that this was a goal to fill the home and try to keep it full with the same people. The idea was to mentor women to be strong, independent women, and move on into independent housing with employment and having their children back, and be positive role models in our community. So just a real quick, in Catherine's house, I have some demographics. The average, we've had 113 residents since we've opened August 8th of 2015. And of those, 19 is the youngest, 60 is the oldest. The average is 23 to 39 years old. Of the 113, 94 had children in foster care. That's huge. 44 did not have legal issues or on probation, but 69 were in the legal system, probation, you name it. And we're running them continually to court appointments and all of the different things that they need to have. The average stay has been around 3 months when we averaged out the whole thing. We did have, of the 113, 21 stayed less than 15 days. Those were addiction issues where maybe they came in the door and weren't right in that right frame of mind that they were ready to, to make the commitment. But of the 113, 111 have mental health issues. 103 chemical dependency issues. Those are large numbers. And in our area, we have nonprofit, outpatient, and this housing setting, of course, I put all my own money and my time and my passion, and I firmly believe that with my Lotus strategy, the longer the term that we can either keep them in Catherine's house, then into independent housing, but we have an open door policy where they've been coming back. So we have some of the gals, they come back during the day, we manage their meds. I don't get any money for that, but it has been a success. Here's one right here, which is Cindy Brown. And we manage their meds. They come back on a daily basis, do groups, activities in the home, go to the horse farm, do all of the different items we do, get their meds, and then they go home to independent housing. And I do believe that after a certain amount of time, that too will be that then they can start to be well enough and secure enough with themselves to manage their meds and then take each of those steps on their way out. So I appreciate you all listening, and if there's any questions, there have been politicians that have taken the time, including Lieutenant Governor Tina Smith, that visited the home. And you're all welcome at any point if you ever visit the Iron Range. Cindy Brown was a former resident. She came to us homeless, and she's now an employee of Blue Cross and Blue Shield, and they were nice enough to give her the day off for the Senate hearing and for this today. And Cindy has her children back in her lives on visits, and I will let her speak.
All right. Thank you, Ms. Holmes, for your testimony this morning and for the work you're doing up on the range there. Ms. Brown, welcome to the committee. If you could please state your name for the record and tell us your success story.
My name is Cindy Brown. Thank you, Mr. Chair and committee members. Last July, I found myself homeless. I had no place to go, no safe place to go. Every friend I knew on the Iron Range were using friends. I had no place to go. If I would not have found Shelley's house, I'm a veteran. I was a former Marine, and McPhee and Duluth actually told me about Catherine's house and got me a referral there to go stay. When I showed up at Catherine's house in Eveleth, I had a clothes basket and a suitcase full of clothes, and that was all I had left to my name. Addiction had taken a toll in my life. If I had not gone to Catherine's house that day, I would be dead right now. I know this for a fact. The Iron Range is not a safe place for women that have no place to go. Yes, there is homeless shelters, but there's no women-only place. When I went to Shelley's house, I felt safe. It's a safe, sober house. It's a home, not a facility. When I first walked in the doors, I actually felt at home that I was going to be safe, that nothing was going to happen to me. Through Shelley's kindness and the services she offers, I go to therapy with her therapist, Steve. He's excellent. I found a job at Blue Cross Blue Shield. I'm a customer service rep on the Senior Gold and Platinum Blue line. I've had 2 promotions. I've had a raise. I'm a success story. I'm one of the rare successes that has succeeded. I'm also in a phase 2 where I'm in independent living through Shelley.
In one of our apartments.
In one of her apartments. And because of this facility, I'm myself again. During addiction, a person loses themselves and they don't remember who they are, or they don't remember how to be a person. But through her facility, I remembered who I was, my education. I have a degree in criminal justice and in industrial engineering. I had forgotten how to spell big words. I'd forgotten everything. But through the healing, through therapy, and just time, I've actually become myself again. I'm actually consider myself better because now I don't have to worry about if I'm going to be safe or what I'm going to eat. Now, what I earn at my job, I can spend on groceries, clothing, whatever I'd like. I'm a human again. And during addiction, a person doesn't feel like they're human. They feel they're less than human. And so many women on the Iron Range don't know of Catherine's house. They have no place. They don't know where they could go. They don't feel safe, so they just turn back to their using friends. And a lot of them I know are overdosing and they're dying. Now, if Catherine's house can get the finance they need and extend their services, so many women on the Iron Range will be saved like I have been. And I owe my life to Shelley, and I am eternally grateful for the help she has given me. And I'm not ashamed of what my life was. I'd like to tell people, I've actually told the people at work, my bosses, they are the ones that let me off for today. And I proudly told my story. And that's why I'm here today telling you my story, so hopefully we can get the financing help that Shelley needs for her home. Thank you.
Thank you, Ms. Brown, for sharing your story with us this morning. That's quite a life change that you've had there. We have a couple questions for the two of you this morning. Representative Baker.
Thank you, Mr. Chair. Again, congratulations, Ms. Brown, on your recovery,
Thank you.
your journey. You were there for a reason, and you're paying it forward now.
Yes.
Thank you for that. And again, Ms. Holmes, thank you for opening the home. There isn't enough of these on the Iron Range. I know that. I don't know if did you say why you opened it up in the first place? I was wondering if I could have that story, because there's a reason you did this too. I think the committee should hear what that is.
Ms. Holmes.
Yes. Well, I'm self-employed in a trucking company. I'm a woman minority contractor. And our family's in the scrap iron business, and I've had issues for 29 years of keeping people employed and people with addiction and dysfunction. So I own a lot of rental properties, and I was always going to start a work release program when I got to a certain point. And so what I did is the county was in need of we discussed the women only, and after my research and trying to figure everything out, I thought that would be the best stepping, to start with. I already owned the building, so I have an 8,600 square foot building that I renovated completely to look like a home, and put a lot of effort into it. If you go to our website, you can kind of see all the pictures with the tongue and groove wood and everything. Homemade quilts on every bed, and put a lot of effort into it. I have a son with addiction issues, and we've struggled for a very long time. And throughout all the research, I found that I couldn't try to save him or, do it. So I put all my effort into trying to help women and other families, and created this program and supportive services so that there would be services for the time when my son was ready to help himself and want to save himself, which, by the way, he is sober and doing very, very well, and other people that I've helped. So I guess I'm very blessed. I've been a hardworking farm girl from northern Minnesota. Now all I know how to do is work, and I just wanted to give back and be able to do something for my community.
Representative Baker.
Thank you, Mr. Chair. Thank you so much for that, and thank you for what you do. You are truly a hero. You are life-saving. I'm someone also who is heavily involved in addiction recovery services and things out in Wilmer and the area out there. We support a lot of sober homes as well for both men and women. And again, we all have our story of addiction, but thank you so much. Representative Metsa, thanks for bringing them here today. Thanks.
Any other questions for these testifiers? Representative Murphy.
Thank you, Mr. Chair, and not a question, but a comment for Ms. Holmes and Representative Metsa. Thanks for bringing this forward. I also had a chance to visit Catherine's, right? And as you describe it, it is a place where you feel like you're at home. As you describe, homemade quilts, separate bedrooms for people. But what I remember the most was your determination to make a place that was safe for people, but also that you had very high expectations for the women that were coming there. You had I don't like the phrase tough love, but you had that attitude, like you break the rules, you're not going to stay, but you're always welcome back as long as you follow the rules here. And I remember the pairing of your desire to see the people coming through those doors succeed, and your high expectations for them, and your determination that they do it right. And I think that's why you're so successful. And I'm really glad you're here before the committee today. Thank you for telling that story, and thanks for doing what you're doing.
Thank you, Representative Murphy. Representative Keel.
Thank you, Mr. Chair. I too want to express my thanks for Representative Metsa bringing it forward, but your dedication, not enough of that is available for people, and we certainly want to see success. And I'm curious, the counselors that are they on staff just for your facility, or do they live in the area? And then how are you able to hire enough people to help, counselors?
Ms. Holmes.
Yes, thank you for asking those questions. They are local. I was able to hire Stephen Taylor, a 32-year psychologist who believed in my mission. I'm big on what I call my mission. And he believed in my rural farm setting and using the horses and the animals and all of the different things and teaching them to cook. And I love to feed everybody. So, yeah, it wasn't hard. I had actually a lot of people. I was hiring 4 at one time and had 47 apply. From resident aides to psychologists, because I really believe what I found, and I was simply amazed, is that they wanted something fresh, something new, and they believed in my mission of what I was trying to do. And a lot of them told me that they liked that there was one person running it, there wasn't a huge board, it wasn't a nonprofit. They figured I was going to be around and really put a lot of effort into it because I spent all of my own money. There was no grant money, there wasn't anything else. The resident aides, as we call them, resident counselors, the day-to-day staffing, I'm not going to say it's not challenging there. There are many waiting. As soon as one goes, there's 2 or 3 wanting to come because they seem to want to be part of helping women. It's finding the right women to be resident counselors that has been a little challenging for me, but I'm not a licensed person in that. I'm from the trucking industry. I can tell you about Cat engines, but so I needed to go out and hire the best, and so I did. I researched and I interviewed and I put together a lot of, I have staff that have degrees in psychology, social work, LADCs, and they have advised me along the way, I think, very well. And I pay them well, and they've put a lot of effort into helping me really build this into what it was. Because I had an idea. I wrote my mission out, but I didn't know the rules, regulations, and compliance part of it. So I needed to hire for that.
Representative Keel.
Thank you, Mr. Chair.
Representative Tice.
Thank you, Mr. Chair. And also to Representative Metza and the testifiers. And there's several things, sorry for the cold, several things that really stand out to me, and I hope that we're paying attention to what's working. Because, number one, you said equine therapy. I've been working with different groups and working on sex trafficking and getting women out of the life. And one of the things that we're looking at doing in my area in St. Cloud is creating a home, and it's going to be called Terebinth House. And basically, it includes equines and that relationship. But it's also creating homes. And I think it's bringing back the normalcy that a person needs to get through the addiction. And I'm also seeing that we're putting them back on the farm. You know, we talk about all this metro stuff and the technology and the clinics. And I'm thinking what we're seeing is what's working is putting them back on the farm. Getting connected with just quietness and nature, and we're talking about animals, and I hope we're paying attention to this because I think this is huge, and we're missing the boat on this one. I think we should be looking at folks that are interested in doing this outside in the country. I mean, this isn't exactly a metropolis. But you see a lot of the community coming forward too, and I think these are great, encouraging things for our smaller rural areas to be doing great work. But I also, as a business person, see that this is what private business people do. They have a problem. You had a problem. Basically getting people to work for you and to have housing and things, and you take care of it. And I just can't congratulate you enough for what you've done. But I hope that we're paying attention to this, that we're looking at some of the components that we've seen a couple times over, and that this is what works. If we're looking for models that work, I think we have to kind of, and in a way, take a step backward. You know, not necessarily do we need the clinics and the sterile environments, and I think we're seeing that in other avenues too, but we need to get it back to a more normal environment. And for that, I thank you. I think we have a lot of lessons to learn from what you've done. And I really hope that we're paying attention to what we're seeing here, and thank you so much for bringing this forward, Representative Metza. I'm glad that you're here today.
Thank you, Representative Tice. Representative Kresha. Oh, excuse me. Are there any other questions from the members for the testifiers? Representative Liebling.
Yeah, thank you, Mr. Chair, and thank you very much for being here. Thank you, Representative Metza. My question maybe is more to staff. I was trying to look and see if, I kind of remember that maybe the Office of the Legislative Auditor did a report, some kind of an evaluation about group residential housing. And because we have here today several bills on group residential housing, and, you know, I always wonder about, you know, coming to the legislature, having to find a legislator and do a bill and come here and do this whole process. You know, this is an issue, of course, addiction and treatment and how we're handling, you know, whether we're getting people what they need to recover. And this is just a huge statewide issue. And I know the members of this committee, we're all very passionate about doing that and making sure that it works. We know we have a huge problem. And I think all of us really want to support different models, and so that individuals find what they need to recover, and, you know, these kinds of great programs. But as a matter of sort of a overarching policy for the state, I just wonder, you know, why we have a system where we're making people come to the legislature, you know, and do these kind of one-off, we need help to keep our program going kinds of, you know, why are we putting you in that situation? So it isn't really a question for you, but I guess it's more for staff, or if any of the other members know if the Office of the Legislative Auditor has done something on this to give us sort of an overview, because, you know, as I'm looking at all these materials, I'm sort of trying to figure out, why do we pay this one this much and this one this much? And, you know, how do we get our arms around this? Because, you know, this is another one of those areas where, and of course, this is the policy committee, not the finance committee, but we have limited dollars, and we want to make sure that we spread them appropriately to make sure we make the absolute best use of every dollar. So maybe can staff respond? I couldn't find anything quickly on the website.
Ms. Punelli.
Mr. Chair, members, I'm not sure if the legislative auditor has done something on group residential housing recently. I'm not thinking of anything off the top of my head, but I can certainly go back and check.
Representative Liebling.
Thank you, Mr. Chair, and thank you. Thank you, Ms. Pugnelli. I think that would be really helpful for us, because, you know, it's, as policymakers, we want to make sure that that we don't make people come hat in hand to make great programs actually have the funding to stay afloat. And on the other hand, we want to make sure that we have the programs we need where we need them, and using our dollars in the most effective way. So, you know, I hope we can find out about this, and maybe as these bills move forward to the Finance Committee, have a little more overall structure to try to understand a little bit better what we're doing overall. Thanks.
Any other questions for Representative Metza or the testifiers? Is there anyone else in the audience who wishes to testify on House File 885? Final word, Representative Metza.
Well, thank you, Mr. Chair, and members for the consideration and comments today. I appreciate it. Like I said in my opening statement, I think this program speaks for itself, and without the dedication from Shelley and her drive with that personal story, which thank you both for sharing yours. It's an honor to be here representing issues like this. This is where, you know, we watch the partisan divide in my mind kind of disappear and look for where the rubber meets the road, and hope that as we move forward, that this program can continue to grow in my community, because I know it'll stay the same right now, currently as it is, but I think if we can access that funding, that we can move in a whole different way. And this started actually 4 years ago, members. And we're looking for different creative ways to figure out how to, you know, finance it, and finally kind of came to terms with, I think we just need to be able to access some of the same money that other programs are, because we got one that's working. So with that, thank you for your time and consideration, and I'll look forward to answering any other questions for those of you on the Finance Committee.
All right, with that, I'll renew my motion that House File 885 be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 885 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Metza, for your bill this morning. Okay, next up, we will bring up House File 1522, Representative Allen. And Representative Allen moves that House File 1522 be re-referred to the Committee on Health and Human Service Finance. We have the bill in front of us. Representative Allen, to your bill.
Thank you, Mr. Chair, members. This bill is to increase the number of beds under the current moratorium on development of group residential housing beds from 190 to 226 for supportive housing units for homeless adults with mental illness, history of substance abuse, or HIV/AIDS in Anoka, Dakota, Hennepin, or Ramsey County. And I have testifiers here today, Mr. Chair.
All right, welcome to the committee. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Chuck Peterson, and I serve as Executive Director of Clare Housing, and we're located in Minneapolis. Clare Housing is a 501c3 nonprofit organization whose mission is to ensure that all people living with HIV have access to affordable housing and the supports needed to maximize their health and housing outcomes. We serve approximately 200 people every year, and our housing programs include 24/7 care in 4 adult foster care home settings. We have a home care program supporting approximately 35 individuals in their own apartments, and an independent living program which includes over 40 scattered site housing programs here in Minnesota. Having a safe and affordable place to live is important in everybody's quality of life, but unfortunately we continue to see very low-income people living with chronic illnesses like HIV choosing between rent, food, and medicine. Having stable housing, clean water, and food makes it dramatically easier to maintain one's health, manage their medications, and stay healthy. Housing truly empowers people's ability to take control of their lives, their health care, and their future. This is especially true for people living with HIV. We know that stable housing works, and we see it every day in our work at Clare Housing. We see strong health outcomes, including 87% of our residents achieving undetectable viral loads compared to 63% of people living with HIV in Minnesota and 35% of people living with HIV in the United States. We also see that 90% of our residents maintain their housing for at least 12 months with an overall average length of stay of 3.5 years, when they often reach a point where they can secure their own long-term stable housing on their own. And finally, we see how stable housing is helping many of our residents turn around and pay it forward by sharing with others the knowledge, hope, and confidence they have gained by being stably housed. GRH has been a lifeline for many of our long-term homeless residents, but the way it is structured doesn't always provide the ladders out of poverty that we all hope it will, as well as allow individuals to live independently. There are 3 ways in which the market and outside forces have limited its effectiveness. First, GRH was designed to be used in a group setting where someone took care of all your basic needs and controlled the funding to do so, and it wasn't designed for independent living, something we all know is a key towards self-sufficiency. Second, rental subsidies have stagnated, and as a consequence, rental supports have been increasingly difficult to obtain for those who are very low income. As a result, providers lack the tools and supports to help homeless and very low-income people transition into independent living settings. And third, an individual has to give up all but $97 of their income in order to gain access to GRH supports. This limits choice. It limits a person's ability to move out of poverty, and again often results in making choices between food, medical attention, and other basic necessities of life. Clare Housing is proposing to take the existing GRH Metro demonstration project to scale by raising the current cap by 36 units. This has been a very successful project that has demonstrated how structuring GRH funding to be more like rental assistance, where an individual pays 30% of their income towards rent, can improve long-term housing stability. We believe as a result of this small technical change, we'll be able to experience higher success rates keeping people housed and maximizing their independence and reducing the public costs incurred as a result of being homeless. Clare Housing strongly supports Senate File 1244 and want to thank you for hearing it today. I'm happy to answer any questions that you may have.
All right, are there any questions for Mr. Peterson? Representative Liebling.
Thank you, Mr. Chair. Thank you, Mr. Peterson. Appreciate your being here and so on. I'm not sure if you're the right person to answer the question, but again, I'm just sort of looking at the bill, and this is an exception to the moratorium on development of group residential housing beds. So I just wonder if maybe you or maybe staff could give us a little bit of the background of why we have a moratorium in the first place that forces you to come here and ask for an exception to the moratorium.
Right.
Mr. Peterson?
I'll defer to DHS staff if they're able to respond to that question.
All right, is there someone from the department who can make their way down? Welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chair, members, my name is Christine Davis from DHS and the Housing Support Services Division. The moratorium on the development of supplemental services for GRH has been in existence since the beginning of the Group Residential Housing Act in the 90s and was a result of containing costs.
Representative Liebling.
Well, thank you, Mr. Chair. I guess that's not too surprising, I guess. But, so how's that going?
Ms. Davis.
Mr. Chair, Representative Liebling, we recognize a lot of requests for additional funding as a result of having a moratorium, so we see you frequently.
Representative Liebling.
So, thank you. So, do you have any guidance for us? I mean, how are we supposed to, what standard are we supposed to use? I'm assuming, this sounds great, what he's presenting, and, we all want to say, sure, and just pass the bill along. That's what we do here, it seems, most of the time. And, but how are we to evaluate these kinds of requests? Do you have any suggestions?
Ms. Davis.
Mr. Chair, Representative, the department has conducted two studies on the supplemental service structure that we have in group residential housing, and so we do have recommendations with conversations that we've had with stakeholders across the state about what could we, if we were to do something differently, what would we do, and recognizing that individuals have different needs. And so having a structure that would support people's needs in different types of settings at different levels of care is something that would be beneficial to address those needs. And so we can share the report with you that we submitted. The most recent one was in December of 2016.
Representative Liebling.
Thank you, Mr. Chair. I think that would be helpful. I just find it's really tough. I don't know. There's a lot of person time that comes and sits around this table. And this isn't just really to you, but just sort of to the committee. We spend a lot of our life energy here trying to do the best work we can for the state. And often it just feels like we don't have any context for the decisions we're trying to make here. And so, here we're hearing a bunch of bills on group residential housing, and it would be really helpful, I think, and maybe this is more to the chair, to kind of give us as a committee some context so that we can make the best decisions and not just say, yeah, you're in front of our committee and we like what you're saying, and yes, we want to say yes to everything, and, wish we could really say yes to all of these great programs and people who come and make presentations, but I think we need a little help sometimes because we do actually have to choose and we have to make priorities, so thank you.
Thank you, Representative Liebling. Are there any other questions for the testifiers? Seeing none, is there anyone else who wishes to testify on House File 1522? Seeing none, final word, Representative Allen.
Nothing further, Mr. Chair. I appreciate your consideration of the bill.
All right, with that, Representative Allen renews her motion that House File 1522 be referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 1522 is referred to the Committee on Health and Human Service Finance. Thank you, Representative Allen. Next, members, we're going to go out of order just slightly and take up House File 919. Representative Peterson, and Representative Peterson, as she's making her way forward, moves that House File 919 be re-referred to the General Register. And I understand there's an A1 amendment, Representative Peterson?
That is correct, Mr. Chair.
Representative Peterson moves the A1 amendment. Representative Peterson to the amendment.
The amendment basically just continues family access to other essential services and is, this is our first committee stop, so we're just getting the bill in the order we'd like.
All right, are there any questions on the A1 amendment? Seeing none, all those in favor signify by saying aye. Aye. Opposed, same sign. The amendment is adopted. Representative Peterson, to your bill as amended.
Thank you, Mr. Chair and members. House File 919 is a Department of Human Services policy bill related to the early intensive developmental and behavioral intervention benefit for children with autism spectrum disorders, also known as EIDBI. Basically, this bill is specific to establishing standards for recently launched benefit for children with autism or related conditions. The department has been working closely with providers, families, and others for over a year to craft this legislation. The goal of this bill is to increase access to services for these children and their families. And I do have a testifier here that maybe can go over a little bit more of the bill, and I also have the department available for questions.
All right, welcome to the committee. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Alex Bartalik. I'm with the Department of Human Services, and I'm very pleased to be with you today talking about a bill that we have spent a lot of time with many stakeholders to get in a shape that will really be able to help children with autism in Minnesota. And thank you to Representative Peterson for authoring this bill. EIDBI, which we have been using for short because the early intensive developmental and behavioral intervention is kind of a long name, but this is a very unique benefit. We are making this available to children, actually all the way up through age 21, who have autism or related condition, to be able to offer a unique set of services that is not just a one set of service in Minnesota, but we're taking a unique approach, and we are allowing clinicians through a comprehensive assessment to determine what is the best service for these children and to document progress. And we're going to be able to learn a lot over time about what interventions work best and how. The original language, or excuse me, the original legislation was passed in 2013. We received federal approval in 2015, and this bill is bringing some changes to the program in order to make sure that it's widely available. There are some different changes that we need to do. One, we want to update eligibility criteria. As we negotiated with the federal government for this bill, there were some changes, including extending the eligibility to age 21, which is consistent with the special education time period that students can also be in school. And it adds related conditions. So, for example, a child with fetal alcohol syndrome who potentially may benefit from some of the same treatments is able to receive that as well. It adds provider standards to make it clear in law who is able to provide the services. And this is important because actually what we have in our federal agreement with CMS is higher, and many providers aren't able to meet it. So we've spent quite a bit of time with providers being able to better describe what we are looking for and making it more practical. It creates protections for children and families, and it also retains and requires certain recipient rights, such as having injury reports, copies of the treatment plan, just things that are important for families. It also, in this bill, lists the treatments that are approved by the program, kind of the range of benefits that a clinician can consider, and it sets up a process. So as we learn more, and as there's emerging technologies, we can incorporate them into the benefit. And lastly, and perhaps most importantly, it allows us to have exceptions to provider standards in some of the enrollment process while we have a provider shortage. And I'm sure you've heard from many testimony during this session that in many parts of the state it's difficult to hire people with the qualifications that we need. So this would allow us to say where there's a shortage, have exemptions so that we can provide alternative standards or alternative requirements while we build up the capacity. We're able to do some of this with the use of a stakeholder group, so we can be working with people who are experienced in the field as well as families. That group has been established through the state register process. We're having our first meeting at the end of the month. So we are ready to get to work and being able to make the changes to this program. I'm happy to answer any questions that you might have.
Thank you, Ms. Bartalik, for your testimony this morning. Are there any questions for Ms. Bartalik? Representative Liebling.
Thank you, Mr. Chair. Ms. Bartalik, thank you very much. And I know this is a product of a lot of work. And I really appreciate that we've come a long way on some of this stuff as a state. I just was thinking about the parents who came before us somewhat recently, maybe it was in the Finance Committee, but the TEFRA issue, the parents who are paying the extra fees to be able to have the Medicaid package of services. I'm assuming that these services are one of the things, so even if we're not able to, well, I hope we can reduce the fees the parents are paying, but this enhances what they get for those fees. Am I correct in thinking that?
Ms. Bartalik.
Mr. Chair and Representative, yes, this is a benefit that once somebody is on medical assistance or through the TEFRA program, a child will be able to receive this benefit.
Representative Liebling.
Thank you.
Are there any other questions for Ms. Bartalik? Seeing none, the committee thanks you for your testimony this morning. Is there anyone else who wishes to testify on House File 919? Seeing none, final questions from members? Final word, Representative Peterson.
Thank you, Mr. Chair and members, for your support.
With that, Representative Peterson renews her motion that House File 919 as amended be re-referred to the General Register. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails and House File 919 as amended is re-referred to the General Register. Thank you, Representative Peterson. Now we'll go back to our order and bring up House File 1445, Representative Lomer. As she makes her way forward, Representative Lomer moves that House File 1445 be re-referred to the Committee on Health and Human Service Finance. We have the bill in front of us. Representative Lomer, to your bill.
Thank you very much, Mr. Chair and members. So House File 1445 proposes to expand and improve our consumer-directed community support program so Minnesotans with disabilities can meet their housing and employment goals. Currently, 5,000 individuals on waiver programs are utilizing CDCS. Those individuals receive an annual budget, develop a support plan approved by the counties, are held accountable by working with a fiscal support entity, but then have greater flexibility in developing their customized service and supports. Individuals on CDCS express a high level of satisfaction with their services. However, there are some barriers that exist in the program that create some disincentives for individuals considering utilizing the CDCS. House File 1445 will address those distinct disincentives so more Minnesotans can benefit from having greater control over the resources available to them. So testifying with me today in support of the bill are Deborah Bailey and Steve Larson with ARC, Minnesota.
All right, welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chairman, committee members, my name is Deborah Bailey. I live in Chaska, and I'm on a caddy waiver. I'm here today to testify in favor of House File 1445 to expand and improve consumer-directed community supports. I would like to have more choices and more control over my care and my services. I have a traumatic brain injury as a result of a car accident. It was just another day. I was on my way to work in January 2012 when I lost control of my SUV after hitting a patch of ice. I spent the next year relearning how to walk, talk, use a knife and fork, tie my own shoes, read a book, and do pretty much everything else in life. I still live with significant impairments in visual processing, planning and decision-making, and energy management, as well as some other deficits. There are a number of reasons why I support CDCS, and I'd like to share some of those with you. While I do want more choices, I am not able to take on significantly more responsibility for overall management of my services. I do not want to be solely responsible for finding and employing caregivers. While I believe I would be able to get some of my services and supplies at a lower cost, I'm concerned about the significant budget reduction I would face. Under current law, I would take a 30% reduction in my current waiver budget to get on CDCS. I believe this approach discourages independence and encourages paternalism. I would like to have a better understanding of my rights and my options under the waiver program. Whenever I have expressed this desire, I have been asked to identify a specific problem to be addressed, or I have been told CDCS wouldn't be appropriate for your situation. With the help of a support planner, I think CDCS would be very appropriate for my situation. I would like more control in choosing caregivers with whom I work well. I would like an easier way to address issues with caregivers. I would like more flexibility in scheduling caregivers. I would like the flexibility to arrange changes directly with the caregiver when holidays, appointments, or other scheduling conflicts occur, or when I would simply like to arrange a particular outing or activity. I would like to encourage more communication between my caregivers. Currently, this is not permitted due to privacy concerns and company policies. I'd also like to share 2 specific examples of issues that I've recently had with caregivers. My independent living skills worker, who typically comes twice a week, was unable to come for 11 weeks last year because of a lapse in the company's license. This caused a significant disruption in my life, and I believe this is a situation that could have been avoided had I been on CDCS. I have weekly skilled nursing visits. Among other things, the nurse helps me manage my chronic conditions. Consistency in this effort is very important to me. During a recent 7-month period, I worked with 8 different nurses. I need more consistent care in order to be successful. When I complained to the company, they promised that they would improve their consistency. They didn't. I eventually asked my case manager for help to change providers in order to resolve this situation. This is another challenge that I believe could have been avoided by using CDCS. Studies have documented a high level of satisfaction for individuals on CDCS. They have also shown that staff turnover is reduced because more of the budget can go into paying higher wages to staff. So I'm asking that you please pass House File 1445 so individuals like me can have greater control over our services and supports. Thank you.
Thank you, Ms. Bailey, for your testimony this morning. Mr. Larson, welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chair and committee members, I'm Steve Larson with the ARC Minnesota, and I'm also here on behalf of the Consortium for Citizens with Disabilities, and House File 1445 is one of the 3 priority bills that the Consortium for Citizens with Disabilities is working on this year. As was stated, there are 5,000 people on consumer-directed community supports. But there are certain barriers there, such as the 30% discount that Deborah referred to, that are preventing other individuals from getting on to CDCS. Individuals that graduate from high school or turn 21 and want additional resources to help them with their individualized employment or individualized housing needs have had limited options to get increases in their budget. Last year, we passed a 20% increase for supported or employment, individualized employment, but that doesn't apply to housing and other needs that individuals need, and that's why we're back here today. This is a package piece of legislation because it goes along with the MSA housing assistance that you have reviewed. It goes along with employment services that you'll be hearing later this morning in this committee. And it also goes along with our Best Life Alliance legislation that will be heard in Representative Dean's committee this afternoon. Because there needs to be 100 different solutions to how we address our direct support professional workforce crisis. Giving an increase such as a wage increase such as the Best Life Alliance legislation calls for is one of those ways. Another way is to utilize individuals to help support persons with disabilities through consumer-directed community supports that wouldn't normally be a support person for a person with disabilities. But the CDCS option provides many opportunities for utilizing informal supports, hiring the neighbor, working with relatives, those types of things that aren't necessarily available in our formalized system. So we're very excited to support changes in this, and we think instead of 5,000, there should be 10 or 15,000 people on our waiver programs that are taking advantage of this if we can break down some of those barriers. There's 3 important components in this bill that address the problems that exist in the Consumer-Directed Community Supports Program. One, the first part of the bill calls for increasing funding through CDCS for those individuals that are in some of our institutions, such as Anoka or St. Peter, or in our crisis beds, and who have not been able to find placements in the community. And so by looking at CDCS as a solution to that, we think we could get individuals out of those institutional placements quicker than we currently are. We're looking at expanding an exception process for CDCS for individuals that in their person-centered plans desire to pursue individualized housing, individualized employment, or a positive support intervention program. And so this would allow us an exceptions process so they could get up to 30% more in their individualized budget that they have. And finally, we're looking at developing a new budget methodology that will address many of these issues. And so this would be a multi-year process in moving forward with a report to the legislature on how we can better develop a budgeting process that works more effectively for all the individuals on our waiver programs. Thank you for this opportunity to talk about the consumer-directed community supports and with the opportunity to address these improvements.
All right, thank you, Mr. Larson and Ms. Bailey, for your testimony this morning. Are there any questions for our testifiers? Seeing none, is there anyone in the audience who wishes to testify on House File 1445? Final call for questions. Final word, Representative Lomer.
It's a great bill. Thank you for your support.
With that, Representative Lomer renews her motion that House File 1445 be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails and House File 1445 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Lomer. Next up this morning, members, we have House File 1386, Representative Albright. And as he makes his way forward, Representative Albright moves that House File 1386 be re-referred to the Committee on Health and Human Service Finance. We have the bill in front of us, Representative Albright. To your bill.
Thank you, Mr. Chair and members. House File 1386 is with regard to housing, and I have a testifier with me, and in light of the time that we have, I will make my remarks brief so that my testifier can explain the bill. But members, we live in an era of unprecedented change within the disability services industry, both with home and community-based services, with the Olmstead Plan, Workforce Innovation and Opportunity Act, 245D licensing, as well as workforce crisis. One of the biggest changes is the DWRS, Disability Waiver Rate System, which was enacted in 2014. Thankfully, the legislature put a 5-year banding period in place. Presumably, the 5-year banding period was to allow time to work out the bugs and provide an adjustment period. Under banding, a recipient's rate couldn't go up or down more than 0.5% in each of the first 2 years, and 1% in each of the next 3 years. But we're now in the 4th year of that 5-year adjustment period, and few, if any, of the bugs have been worked out. The rate formula is seriously flawed. The goal with 1386 is to ensure that access to quality services continues uninterrupted for people served as we work our way through this morass of unprecedented change, with the emphasis being on protecting the people being served. This protection only applies to day service recipients who will see rate cuts exceeding 5%. I won't go any further. I'm happy to stand for questions, but I will turn over the remainder of my time to Mr. Weaver, who is my testifier this morning. Thank you, Mr. Chair.
Thank you, Representative Albright. We heard every word you had to say there. Welcome to the committee, Mr. Weaver. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Tom Weaver, and I'm the CEO of Achieve Services, and we are a day training and habilitation program in Blaine, and we serve about 190 adults with developmental disabilities in and around Anoka County. Roughly 54% of the people we serve work in jobs in the community. We also serve a number of very high needs people, people who are non-ambulatory, nonverbal, people who need assistance with very basic daily functions. 51 of the clients that we serve have been with us for 25 years or longer. Achieve has been around for over 50 years. As Representative Albright indicated, this is a time of unprecedented change in this industry. In addition to the changes he identified on the policy side, we also are in a time when DHS is carving out the employment services that we provide, and we'll be setting new rates for those. And we recently learned that the non-employment services that we provide will also be carved out, and new rates will be set for those. So there's just a ton of uncertainty in this industry right now. And in light of that, we've been having meetings for the last couple of years with the parents and families of the people we serve, and I just can't tell you enough how much frustration and anger and confusion there is, and people are frightened about the future of services for their loved ones. But the biggest problem, biggest challenge that we face right now is the DWRS, the new rate system. And Representative Albright indicated that that system is flawed. It is. DHS's own report indicates that 63% of service recipients will be seeing rate cut under this new system. For the people we serve at Achieve, on average, they will be experiencing a 34% rate cut. And again, we're in the fourth year of a 5-year banding period. Thank God that the legislature put that banding period in place to give us some time to work out some of the bugs. But we're in the fourth year, and the bugs still exist. What we're trying to do here is provide a softer landing for the people who are getting hurt the worst under this new system. The way it's looking right now under current law, if you're experiencing a 34% cut, after the 5-year banding period, you will have lost 4%. So on January 1st of 2019, you will see another 30% cut, which is just not sustainable. So what this bill does is for those who are losing more than 5% of their rates, when you get to that cliff in 2019, instead of seeing a 30% cut, you would continue to lose 1% a year until you get to that new rate. So again, it's essentially a parachute for people who are getting hurt the worst. We know that everybody's going to be stepping out of the plane, and we know that they're going to hit the ground sooner or later. We're trying to give them a little more time in the air and a softer landing when that happens by phasing in this cut over a longer period of time. This again provides a safety net and some stability for people with disabilities who, through no fault of their own, are experiencing significant, again, greater than 5% cuts. It helps ensure that individuals with the biggest rate cuts will continue to have access to the services that they choose. It brings some simplicity to an extremely complex environment. It's a commonly used grandfathering concept. It helps the rate losers without taking away from the rate winners. If the DWRS formula is adjusted, and there's other legislation that would do that, that hopefully will reduce the number of people who are losing more than 5% and reduce the number of people who need this protection, but there still are going to be some. It also creates a strong incentive for providers to maintain high-quality services and keep those people in our programs, and it moves the state toward the CMS goal of more uniform rates in a much less disruptive manner. Should also point out that we're not asking to increase anybody's rates or put new money into people. We are asking to slow down the reduction in their rates. And finally, I would just also add that this proposal is being supported by MINFAC, which is the Minnesota Family and Advocates Coalition, which is a statewide network of families and parents of people that we serve. With that, I'd be happy to take any questions.
All right. Thank you, Mr. Weaver, for your testimony this morning. Are there questions for Mr. Weaver, Representative Liebling?
Thank you, Mr. Chair and Mr. Weaver. This isn't really so much a comment to you, but I just was really interested in your use of your metaphor about stepping out of the plane, and it just really reminded me that our whole state, I think rather than stepping out, which implies there's a voluntary action involved, we're going to be pushed out of the plane. The whole state is going to be pushed out of the plane with regard to Medicaid. we're going to be pushed out by Republicans in Congress and the administration. And I just hope that we all have some kind of a parachute. I mean, this is going to be very, very serious. What you're describing, which is, happening now, just under current law, I just have a feeling that we ain't seen nothing yet. So I hope we can find parachutes. Thank you.
Any other questions for Mr. Weaver? Representative Murphy.
Thank you, Mr. Chair, and probably more a comment for Representative Albright and for Mr. Weaver. As I understand this in very simple terms, what we're hoping to do is to spread out the impact of what has been a reduction in rates over time. So we want to stretch that duration out, make it a little easier. And so for us, I think when we get to finance and to the next committee, we're going to have to consider that in terms of the upcoming budget and then the tails. And we're going to have a devil of a job in that committee trying to balance the requests that are coming in, especially when what we expect to see is a fairly significant tax cut target as well. So I just am going to urge you, if this is important, to make sure and continue to put pressure on the leadership of the body, because they're the ones who are going to make those decisions about where we spend our scarce resources, if we put them into things like this or if we put them into tax cuts. I think you're making a strong argument for evening out the impact on what this would be, a rate reduction for people with disabilities who are counting on us. But we're going to need your help to make that case up in the leadership corner, because I don't think I can successfully make it on my own.
Thank you, Representative Murphy. We will be there.
Thank you.
Thank you, Representative Liebling and Representative Murphy. Is there anyone else in the audience who wishes to testify on House File 1386? Any final questions for the bill author or Mr. Weaver? Final word, Representative Albright.
Thank you, Mr. Chair and members, for your consideration of this bill this morning.
With that, Representative Albright renews his motion that House File 1386 be referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 1386 is referred to the Committee on Health and Human Service Finance. Thank you, Representative Albright. All right, and next we will move to skip order just a little bit. House File 1239. Representative Albright. Just one more into the pile. House File 1239, and Representative Albright moves that House File 1239 be re-referred to the Committee on Health and Human Service Finance. And members, it would be my intent that we would recess in about 10 minutes so that we can make our way to the floor. Representative Albright, we have the bill in front of us. To your bill.
Thank you, Mr. Chair and members. House File 1239 establishes 3 new employment support services that Minnesotans with disabilities could access through the 4 disability waivers that have been available here in Minnesota. Here in Human Services Reform Committee, as well as in various settings across the state, there are important conversations taking place about how we as a state can address current identified barriers to Minnesotans with disabilities living meaningful lives in our communities based on their own choices about where and how they live, learn, and work, and play. This bill moves our state towards this goal by establishing support services that Minnesotans with disabilities could access as they work to find and keep community employment. I have with me today 2 testifiers to speak very briefly about the importance of this bill, Lynn Noren, with RISE, as well as Andrea Zuber with Dakota County. Thank you, Mr. Chair.
Thank you, Representative Albright. Welcome to the committee. If you could please state your name for the record and present your testimony.
Chair Schumacher and committee members, my name is Lynn Noren, and I am the president of RISE, an organization that provides community inclusion and employment services, serving nearly 3,000 people with a variety of different abilities throughout the Twin Cities and central Minnesota. I'm here today to testify briefly in support of House File 1239 on behalf of RISE, as well as on behalf of our broader Day and Employment Service Provider Association, MORE. As you are all aware, from the Olmstead Plan to new federal rules about what community-based disability services will look like in the future, to new federal rules about the path that young people with disabilities will take as they prepare to leave school and enter the workforce, there are many interrelated initiatives that are currently pushing us as a state to have increased flexibility and options for Minnesotans with disabilities as they pursue meaningful lives in our communities. The bill before you today represents a concrete step forward towards this shared goal by establishing both the policy and funding infrastructure necessary to create a set of 3 new supports that Minnesotans with disabilities can access to secure more independent, community-based employment opportunities. These services will help youth especially to bypass services in the future that can often be difficult to exit. The 3 new employment services established in this bill are as follows. The first is Employment Exploration Services, which are community-based orientation services that introduce a person to competitive employment opportunities in their community through individualized educational activities, learning opportunities, work experiences, and support services. The second are Employment Development Services, which are individualized services that actively support a person to achieve paid employment in their community. Employment development assists people in finding paid employment, becoming self-employed, or establishing a micro-enterprise business within their community. The third service is Employment Support Services, which are individualized services that help people with maintaining paid employment in community businesses. Sections 1 and 2 of the bill address how the new employment services will differ from currently available services. Essentially, this is a section of the bill that clarifies that these new employment services will not be provided as a component of day training and habilitation and will be billed separately in the future. Sections 3 through 8 make technical changes to support the provision of these new services, again related to the separation of these services from day training and habilitation. Sections 9, 10, and 11 outline components of how the rates for these new services will be determined in DWRS, or the Disability Waiver Rate System. And the 12th and final section of the bill instructs the state to seek necessary federal approval and proceed with creating these 3 new services. We know that the state legislature will be faced with many difficult decisions this session about how to use very limited state funds in a more cost-effective and impactful way. We hope that you will view this particular piece of legislation as a very important and tangible step that you can make to move our state forward. We ask that you support these services, which will support Minnesotans with disabilities to have meaningful and more independent lives in our communities based on their own choices about where they live, learn, work, and play. Thank you so much for the opportunity to testify today.
Thank you, Ms. Lauren, for your testimony this morning. Welcome to the committee. If you could please state your name for the record and present your testimony.
Sure. My name is Megan Zeilinger, not actually Andrea Zuber. She was unable to make it here today. And I'm here to testify on behalf of both Dakota County and the Minnesota Inter-County Association in support of the creation of the 3 new employment services. The new services will make individualized integrated employment accessible for a far greater number of people with significant disabilities in Minnesota who want to work. The new services will ensure that we are meeting the requirements of the HCBS settings rule, WIOA, the ADA, the Minnesota Olmstead Plan, and the Employment First policy, which are federal and state level directives mandating that if people want to work in an integrated setting, we need to direct funding and services to support them to do so. The Minnesota Office of the Legislative Auditor released a report this year on the financial oversight of home and community-based services. The report notes that Minnesota needs to improve our ability I'm sorry, I'm reading this for Andrea, to improve our ability to support people with disabilities to work and live in integrated settings, and that Minnesota is significantly lacking in the area of providing integrated employment services currently. What we hear every day from people and families in Dakota County is that people want to work in integrated settings. In Dakota County, I personally am currently meeting with all students as they're leaving the school system in June that have significant disabilities. So far, I've met with 34 families. 33 of them are planning for integrated employment. This is an incredible sea change from what we've experienced in previous years, but we also hear from these families that it's really difficult and complicated for them to access services necessary to support them in their employment goals. So we currently have employment services available that are only working for a very small portion of people with disabilities, 13%, who are accessing vocational or day services in Minnesota. Through several pilot projects we have been running in Dakota County to increase employment outcomes with people with disabilities, we have learned that the more we focus on informed choice, the key word in all of this, where we let people and their families know that integrated employment is something they can choose. When we talk to them about what employment would look like in their lives and explained how their benefits would be impacted, the more we see people that are choosing employment over segregated work. We are finding many more people that want to work than are currently working today. One of the pilots we ran in 2016 was in conjunction with the State Department of Vocational Rehabilitation Services and PROACT, which is the 4th largest state training and rehabilitation center in the state of Minnesota. It was called Way to Work. The concept was that we could get, if we got people good information about integrated employment, and we made those services available to anyone who said they wanted to pursue that route. An astonishing 125 people within that Egan Center, or 58% of those that were served in Egan, chose to pursue integrated employment. The National Core Indicator Survey, which asked people in DT&H across the state whether or not they wanted integrated employment, also showed that 58% of people in DT&H said they wanted to move to integrated employment. Interestingly, in the Way to Work pilot, we have also started to see cost savings once people go to work. In conclusion, of nearly 60%, and that number will likely grow as people go to work, of people currently want employment and employment services and supports, we need to design a system that really works for them as well. The new services create a clear path to move someone from school or DT&H to employment by breaking down the planning process and the service components necessary to do so, and very importantly, ensuring an informed decision-making process, as well as incenting the development of system capacity to build those services. These services would allow all of us to ensure an equitable service delivery system where all people are able to get their needs met in a way that would make sense for them. Thank you.
All right, thank you, Ms. Eilinger, for your testimony this morning. Are there any questions for the testifiers? Seeing none, the committee thanks you for your testimony this morning. Is there anyone else who wishes to testify on House File 1239? Seeing none, questions from members for the bill author. Final word, Representative Albright.
Thank you, Mr. Chair.
With that, Representative Albright renews his motion that House File 1239 be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 1239 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Albright. And with that, members, we will stand in recess until 6 p.m. tonight in room 200. We'll see you then.